148 prisoners pardoned by Somalia's President Mohamed Abdullahi Farmajo on Thursday have today been released as part of a measure to prevent the spread of coronavirus in Somalia. President Mohamed Abdullahi Farmajo said the release of the 148 prisoners with petty crimes follows a report submitted to him by the country's Attorney General on the conditions of the prisoners in the country in the wake of COVID-19. The President had directed prison authorities and the Ministry of Health to take adequate measures to prevent health risks for the remaining inmates. President Mohamed Abdullahi Farmajo said he invoked Article 90 of the Provisional Constitution, which grants him powers to pardon prisoners who are not serving sentences for serious crimes. The Horn of Africa nation has so far confirmed 7 COVID-19 cases involving Somali nationals and foreigners. Somalia has banned both domestic and international flights and public gatherings, among others, to contain the spread of the pandemic. There are estimated 1,200 prisoners in the central prison in Mogadishu, according to the United Nations Office of Drugs and Crime. Previously, the prison in Mogadishu was the only prison that was under the responsibility of the Ministry of Justice, Religious Affairs and Endowment of the Transitional Federal Government of Somalia. An earlier report by the United Nations Political Office in Somalia stated that prisoners' living conditions in Mogadishu Central Prison falls short of meeting minimum international and national standards. The government's decision has been commended, having in mind that the prison facilities are not at par with the required standard. So far, 7 people have been diagnosed with the virus, while others have been quarantined for testing after they traveled into the country from affected countries. All learning centers have been directed to close for 2 weeks and civil servants ordered to work from home, whereas international flight as well as local flight have been banned, except cargo planes with humanitarian supplies such as food and medicine. Neighboring countries such as Kenya and Ethiopia continue to record more cases as they struggle to contain the virus which originated from China.